Welcome to Providence Regional Medical Center in Everett. My name is Devora Overbay, and I'm here to introduce you to our Quality and Safety Plan. The leadership of the Board of Directors, medical staff, administration, and hospital have jointly developed the Quality and Safety Plan for Providence Regional Medical Center in Everett. The pursuit of quality permeates all jobs, with each employee striving to do the right things at the right time and do them well. Core to quality and safety is the recognition of interdependence by and among all caregivers, including employees, practitioners, departments, services, and others across the system. Much will be expected of those who are entrusted with much, according to Luke. We set highest standards for ourselves and for our ministry. Quality is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with professional knowledge. As a result, all health care should be safe, avoiding injuries to patients from the care that is intended to help them, timely, reducing waits and sometimes harmful delays for both those who receive and those who care. Effective, matching care to science, avoiding overuse of ineffective care and underuse of effective care. Efficient, avoiding waste in order to maximize value. Equitable, providing care that does not vary in quality because of personal characteristics, geographic location, or socioeconomic status. Patient and family-centered, honoring the individual and respecting choice. What does quality and safety look like to the patient? We need to ask ourselves these questions. How do caregivers communicate? How do caregivers treat each other? And how do caregivers talk about each other? It is often a hallmark of quality and safety when caregivers communicate well and treat each other with respect. That can be evidenced both in the way they speak to each other and about each other. First to be discussed in our quality plan is our response to a change in patient condition. PRMCE utilizes the Rapid Response Team. The purpose of the Rapid Response Team is early intervention and stabilization, and to provide urgent or emergent response to acute physiologic deterioration. Possible reasons for activation include, but are not limited to, acute respiratory compromise, circulatory compromise, or neurologic compromise. A person need only dial 66 to activate the response team. When you speak to the operator, be sure to include the unit location and patient room number. The central switchboard will then page the rapid response team members. Response is usually within 5 to 10 minutes. Team members include an ICU RN and a respiratory care practitioner. The primary RN should remain with the patient and work with the rapid response team. Rapid response team members will gather information, assess and assist the staff in formulation of a plan. Assist the RN in providing an SBAR to the provider. Don't forget that the provider must be notified of a rapid response team call. Rapid response team members will assist with a transfer to higher level of care if that's necessary and will document the event. The primary nurse or activating unit will notify the unit charge nurse of the rapid response team call and communicate with the patient's family. When rapid response team arrives, the primary nurse will provide an SBAR, which includes the patient's history, reason for admission, current condition, and the reason for the call. The RN documents the events leading up to the rapid response call and will provide a detailed report if the patient transfers. There are several nurse-initiated orders approved for the rapid response team to utilize. These include ECG, IV, oxygen, chest x-ray, certain serum blood labs, administration of IV fluids, and increase in vital sign frequency, according to the patient's condition. Alarm management is another very important component of the safety plan. Clinical alarms may not be disabled without an order from a provider. The parameters and settings may be adjusted as per the nurse's clinical judgment. The alarms must be audible by all staff. Alarm settings should be verified at the beginning of each shift. More information can be found in the Clinical Alarm Management Policy, which is located in Policy Stat. Remember that alarms are everyone's responsibility. The mission at PRMCE is stated as the following: as expressions of God's healing love, witnessed through the ministry of Jesus, we are steadfast in serving all, especially those who are poor and vulnerable. Our core values include compassion, dignity, justice, excellence, integrity. It is important to review our mission as we discuss our safety plan because our mission and goals should be infused in everything we do. Data is collected for a variety of reasons, one of which is to report to our accrediting and registry agencies. We report to CMS and the Joint Commission to benchmark against national averages for process improvement and goal setting. Some examples include severe sepsis, septic shock, cesarean births, and discharge on antithrombotic therapy. We participate in Qualis Health and Washington State Hospital Association's Medicaid Quality Incentive programs by reporting our strategies for infection prevention, safety, ER utilization, safe deliveries, and various nursing indicators. Inpatient quality metrics include CAUTI and CLABSI reduction, prevention, early detection, and treatment of C. diff, as well as surgical site infection prevention. Regulatory agencies that we report to include Joint Commission, Snohomish County Health Department, and Washington State Hospital Association. PRMCE's quality reporting structure includes Quality Committee, Patient Family Advisory Council, Performance Improvement Teams, Environment of Care Committee, and Infection Prevention and Control Committee. Some tools that PRMCE utilizes are both industry standards and state-of-the-art. Members of the quality team are skilled in quality improvement and encourage and mentor caregivers to use these tools and skills as well. Caregivers are encouraged at PRMCE to write UORs or unusual occurrence reports so that we can determine what causes the occurrence and how to prevent it from happening again through failure mode analysis and root cause analysis. Some other tools and skills deployed at PRMCE include Six Sigma, a methodological 5-phase process, through Workout, team-based problem solving, CAP, acceptance and ownership, Lean, which strives for continual elimination of waste, High Reliability, which are behaviors, tools, and tones, Team Training, which focuses on high risk, and Service Line Assessment and Analysis, that is an examination of core business services. Principles to guide the use of our data include disclosure, which is assuring that caregivers are informed about outcomes of care, including unanticipated events. Providing staff support, including spiritual care, employee assistance, and debriefing. Confidentiality is a principle guided by ethics, hospital policy, as well as state and federal statutes, rules, and regulations. And transparency, which is where open and honest communication occur during and after safety events. In reviewing PRMCE's safety plan, we discussed the quality principles, rapid response team roles, clinical alarm management, data management, quality improvement tools, and communication principles. If you have further questions or need more information, please reach out to your clinical educator or your assigned unit supervisor. Thank you.